otherwise, let's just talk. I mean, Mastermind's about talking to each other, learning from each other. I was just at an amazing Mastermind entire weekend in La Jolla, California. And it's sharing what we know with other people, and it was fantastic. So, all right, here we go. We're just going to start. Patty, you already have us on, and again, as people join us, they join us. So this is our third Mastermind. I don't see either Cindy or Mike Ventriello. I know Mike tried to call in about an hour or so ago. Brant, I don't know if you want to follow up with them. So my official title, of course, is Chief Dental Codologist. That is the picture from my room of where I am in Waikiki Beach, Hawaii right now. That literally, I'm looking at it as I talk, but that's the view. Pretty amazing place. That's why Patty Beeson has agreed, and she's running the GoToMeeting for us, and her knowledge of this technology is limited. There we go. Did I say it right? And the thing is that here's the thing that we're really doing on this. We are having a synchronous connection. Now we're going to talk about.
There you go.
There we go. We're talking about teledentistry today, and I'm really excited. That was the voice of Brant Herman from Mouthwatch, and he's going to participate fully with us. I can't tell you how excited I am about this subject. Go to the next slide, Patty.
There he is.
There he is. There he is. This subject to teledentistry. Actually, I met Brant. It'll be, what, 5 years, Brant, since at the Greater New York when we met?
Yeah, yep.
Yeah, 5 years. And literally within the first hour of him introducing the product at the Greater New York, I walked up and I'm like, yes, what I've been looking for and what I think is so, so important. And now it's moving very, very quickly. The whole idea of teledentistry and the idea of what we can do with connections. I mean, if you really think about this, the whole thing is pretty freaky. Here I am in Hawaii, connecting with all of you in our various time zones. Our world has changed and gotten much smaller because of this technology. So go ahead, Patty, move to the next slide. Now, teledentistry disrupts traditional oral health. And it needs to be disrupted. Not because we haven't done a good job. We've done an amazing job. Actually, it's really interesting, again, that I'm here in Hawaii. I've told the story in almost every one of my courses, and it's the changes that we have made in the years since World War II. When the Japanese decided to bomb Pearl Harbor back in 1941, the military leaders had to decide, what did it mean to be dentally fit to go to war? But what did they know? So what they decided is that the parameters were the same. Well, World War I parameters were pretty good. That was that you had to have 12 teeth. Yeah, you heard me right. 12 teeth. That's all. And the real power of the story of how far we've come is that by the end of 1943, that parameter had to be dropped. Why? They couldn't find enough 18 to 21-year-old young men with 12 teeth. Reason I tell that story is because we have done a fantastic job. Because I'm a futurist and always talking about what can be, people think that I'm not satisfied. Yet, in some ways, I'm not. I think we could do better, because one of the things I know we haven't reached is total health. We have a lot of really sick people, and that includes oral health. Their oral health that's affecting their systemic health. Go to the next slide, Patty. If you have not read this book, write this down. The book Teeth by Mary Otto is a must read for all of us. And not just for yourself, it's also for your patients. Mary Otto she's a health reporter, and she's done an amazing job of helping to really lay it all out of what the challenges are with dentistry, how we've gotten where we, goes into a whole history of how we've gotten, why are dentistry and medicine separate. She's done a great job about why we have issues with access to care, but in addition to access to care, it's equality of care. Because even at times when people can access it, they still don't have the same level of quality of care. So that's why this idea of disruption is needed. But also, another reason why we need to disrupt our status flow, again, not because we haven't been successful. We certainly haven't been successful for everyone. Next slide, Patty. is this is a statistic, though. This came out of Dr. Bicuspid, but it's actually, though, based on some research that just came out on the 31st of August that said the #1 reason that's avoidable for going to the emergency room is the toothache. Now, we know this, yet we continue to do what we've always done. That's why disruption is needed. We need to do something different. Next slide. And that's why I am so thrilled that teledentistry actually disrupts our oral health care system in the most positive way. Hooray! Okay, next slide. I'm Patty. Cindy Purdy and I are working on our teledentistry critical choices book. Now, one of the things about being a dental codologist, because that is your title, the whole idea of this dental codologist membership is to bring together those of us that really want to make, not just wait for the future to happen to us, but forge our own future. Now, when it comes to teledentistry, there's lots of important choices that you'll need to make. And it's not only for the access to care. We're going to talk a little bit more about how we can use it now, no matter where you are. There's a way teledentistry can fit into your everyday work life. But there'll be some choices for you to make and some things for you to think about. So as a dental codologist member, which is what DCM stands for, you get 50% off of any of the books. And right now we're in a pre-sale of this book. And so you can go to Dental Codology and order it. I know Jean has already done that, as well as several other of you. Next slide. So this is about building the foundation together, because the reality of it is I can't do it by myself. We need to do it all together. Next slide. This is like film strips. Beep, beep. Anyway, the benefits of teledentistry are really clear. They're very clear to me and some of us that have been working in this arena for a while. And that certainly is that profitable outreach to our community. Where I'm really excited, though, is the intra-professional connection and collaboration opportunities that it's going to bring us. Our way that we've been connecting with each other hasn't changed much through almost my entire career. It's a way to attract new patients and bring more revenue streams into our practice and move toward a values-based healthcare system. Now, this is a really interesting concept that is not new to me, but it's still not well known. Next slide. Where we are now is we are currently in a pay for volume. In other words, the sicker people are, the more money we get paid. And in a system like that, it focuses on process and really doesn't use as much data. The workforce is rigid, and the practitioners themselves, are the exclusive source of information. And we provide our care in silos. Now, this is what our system has been. Again, sicker people get, the more compensation we receive. Now, a lot of us on this call, not only, are dental hygienists, and we like to believe we're prevention oriented, yet we're still disease based. And when we only look for disease, find disease, and treat disease, we're not helping people be as well as they can be or be as healthy as they can be. That's why really, for almost anybody that studies the healthcare economy, no matter what their political position might be, is that shifting our system from one of paying for volume to paying for value has much greater longevity. And then the focus is on the patient. And as you can read there, primary care is expected to manage with populations. We need data to do that. The idea of big data, the more data that we can realize. Now, big data is a term that we aren't using enough in dentistry. Big data is being used about you all the time. Oh, what's big data? Well, Target can predict when a woman's going to get pregnant. Not when she is, when she's going to get pregnant. Ew. Who has ownership of your healthcare records right now? Almost everybody except you. And this is why when we talk about moving them into a value-based system, we're talking about loosening restrictions and expansion of duties. This is particularly important because of the workforce availability that we have that is underutilized. Hello, excuse me, 1 second. This is my husband who has been on my hello. And everybody here on my teledentistry conference is hearing you. So I will talk to you later. Bye. He fell asleep. Sorry. He was lost there for a while here in Hawaii. Okay. I want to get it later. Anyway, the idea of the loosening of our restrictions and an increased dependence on evidence-based decision-making. Now, evidence-based decision-making is what we talked about in our last webinar, our last mastermind. By the way, the idea of that you can watch the masterminds, at this point, we're still building the portal out of the website, out of my website, my storefront. But if anybody would like the links to watch those previous sessions, I definitely can share that with you. Now, the most important part that we're talking about here when I'm talking about this value-based system is that last bullet point there, and that's the increased collaboration through technology. That's what teledentistry is, that we can increase our connections to each other, with our patients, with each other, and all the way around through technology. We're doing it right now. Like I said, this is a synchronous connection. Next slide. So telehealth is the umbrella term. And by the way, this isn't going to be Patty just talking. I'm just trying to set the table here for our discussion. Telehealth is the use of any kind of electronic information and telecommunications. And it's not new. It's been around for a while. It's been well tested. As a matter of fact, I've read lots of books on telemedicine and how far telemedicine has come. And it's been going on in telemedicine and telehealth for a while. And this term it's kind of shifting from the telemedicine, teledentistry to telehealth, although like a lot of things, we're in the middle of the shift. Now, next slide. At this point, teledentistry, as so many other things, and almost everything in dentistry, is subject to applicable state law, regulations, and licensure. And that's what we need to understand about what each of us can do in our various practice situations and what we can't. What we have to be careful is who we listen to, though, to find that information. In order to, I believe, in order to really understand all of the pieces and parts, you need to become very familiar with your own State Dental Practice Act. Now, a lot of times we think we are, but maybe it's my Bible-beaten Baptist upbringing, but I'm going chapter and verse. In other words, what I'm trying to say is you need to know where to specifically find information in your own Practice Act and rules. Because being clear on where those lines are, one of the things about the dental codologists, we are the leaders. We are the models for a lot of different things within this world, and within the world of dentistry and dental hygiene particularly, and within teledentistry. So we need to be clear on what these rules are. Now, teledentistry, of course, is a means to an end, and that's improving our patients' oral health, improving and healing. See, I believe, as I said in our first mastermind, I believe that we can have a world where, let's see, we have no periodontal disease because we cured it. We have no oral cancer because we found it early. And we can meet the World Federation of Dentistry and have a caries-free world by 2020. We better get working on it if we're going to make those goals. Teledentistry is, again, a means to an end. Next slide. Patty?
Yeah.
Next slide. Hello.
I'm trying. For whatever
Okay.
reason, it doesn't want to move. There we go.
Now, I don't want to confuse things. There's different types of teledentistry. So this is not to go into each of these types. The words I want you to become familiar with, you may or may not be already, and that's the words synchronous and asynchronous. Now, next slide. As I said, we're already doing a synchronous connection right now. An asynchronous connection, you probably did a whole bunch of today too. What's an asynchronous connection? That's something as simple as an email. What it is that we create it on one end, it's read and interpreted at another time, okay? That's an asynchronous connection. I say it that way, excuse me 1 second. Excuse me 1 second. I'm sorry, I'm doing that now. We had somebody come in to repair our bathroom in the middle of our session here. Okay, so asynchronous. Asynchronous is, again, us connecting. We are connecting at different times. Okay, the next one, go Patty. A synchronous connection is nothing more than, again, exactly what we're doing here and talking to our healthcare providers live. Next slide. So, what communication is more effective? The words large maxillary tori, now that just did a picture in your mind, right? But, look again, Patty. Isn't that even more effective? Isn't that more effective to see that large maxillary tori? Now that happens to be my palate, what you're looking at here. Now here's the question for you to think about. Is that tori precancerous? What? Well, the answer I get most often is, of course it's not. Of course it's not. Except when we're talking about risk assessment, we're talking about looking at things and the patient becoming the center. Many of you on this call already have some idea of what my health has been. You might see that differently. That's the important part we're trying to get is teledentistry gives a visual way of sharing information. Next slide. So we can certainly with teledentistry bring care in from community sites. It links us to the community. You can emphasize prevention and early intervention activities as well as connect to each other. Next slide. That's the current way that we connect. Some lousy paper forms, or even if it's electronic, it's still just a form that doesn't really bring any life to it at all. Our referral landscape, our connection landscape has been the same for a really, really long time. And this is what, when we refer somebody out, that's what we send. When we get somebody back, that's what we send. But what if we could show to the referring source or former referring source what's actually happening? How much better could we communicate? Now we're doing we do some level of connection now when we send x-rays. Here's something for you to think about. Why is it that when a patient moves from one practice to the other and they ask for their records to be sent, what do we usually send? X-rays, that's all. Why don't we send records? Why don't we send more? And why hasn't anybody ever questioned that besides me? It certainly is something for us to think about, is how we can better connect to one another. Next slide. One of the things that we have when it comes to connecting between practitioners, there are no universal guidelines. And what that really can mean is it can result in higher cost as well as an interruption in disease and diagnosis and treatment, as well as really where my head really goes is the risk. See, long before there's disease, there's the risk of disease. And we need to begin to start treating risk as well as active disease. Next slide. There are some programs that are being put together for interprofessional oral health referral. A strong referral system certainly can increase patient satisfaction as well as the outcomes, as well as the practice viability. You know the giant camera? Apparently not. So a strong referral system is really important. And again, we can do that with teledentistry. Next slide. Patty, there it is.
Yeah.
So this is in Dentaltown back in September. And the question that I ask in this particular CE article, which you can find if you want to link to it, let me know, is why does it take codes to help us to change? Well, reality is whether it should take codes or not, it does seem to take codes. And as we've talked about in our other masterminds, codes are really important for quantification and the metrics that we need, particularly in a value-based system. Next slide. This is the two codes as they will appear in CDT 2018. We have a teledentistry code for synchronous real-time encounter and an asynchronous information stored and forwarded. That's why I wanted to explain those words earlier, because they are the words that are used in these specific CDT codes. Now, when we're talking about codes, as I already mentioned, codes are for quantification. They're for metrics. They're for measurability. They're not only for payment of any kind of benefit someone has. So if a code exists, it's very important that we use it. And again, this is the group that's going to be key to making that happen, particularly within the teledentistry realm. Next slide. Now, teledentistry, again, is a broad term. And at this point in time, there's different intraoral cameras, there's different systems, but there's only one turnkey solution that's already specifically designed for teledentistry that I can tell you about because I'm so excited about it. But we have the honor of having Brant Herman from Mouthwatch right on this call. And Brant is an amazing entrepreneur and just sees things. He's a futurist. I love futurists. See things beyond where we are today. So Brant, I'm going to have you take over, take 5 or 6 minutes. And then guys, what we're going to do is we're going to talk about what you understand, what you don't understand, where you might see some barriers, some challenges, that sort of thing. But Brant, take the ball and run.
All right, thanks so much. From a much colder place than Hawaii. So everyone can hear me okay? So we started Teledent. We started Mouthwatch about 6 years ago, and our goal was really connecting patients to providers in innovative ways. And we see the opportunity with teledentistry as not only reaching patients earlier in the disease process, but being able to be a platform that can connect all types of providers, dentists, hygienists, patients, regardless of location. So our platform is cloud-based. It allows for live video conferencing like we're doing now. And it also allows for asynchronous or store and forward. So we started about last year really digging into opportunities for hygienists to be able to go off-site, get out of a traditional practice setting, and see patients at the point of care. So whether that was public health programs such as schools, Head Start programs, nursing homes, rural areas, we wanted a hygienist with portable equipment, whatever shape or form that took, and a laptop or tablet and an intraoral camera to be able to go somewhere and really provide those critical preventive care services that not only help improve patient health and well-being beyond just dental care, but overall health, especially in settings like nursing homes or special needs, but provide a key way for that visit to a patient to be looped into a dental home so that a hygienist could connect the patient to a dentist that they were affiliated with or could refer to in a way that was more than that slip of paper that Patty showed before in the presentation. We wanted it to be a dynamic conversation that was happening where patients visually saw more of what was going on with them, and that they also were able to collaborate and share that information to a dentist who's more inclined to see that patient. They visually understand. We talk about telephone triage, that even if you make that referral, you're describing it to a dentist, they don't know how to allocate time for it. It becomes a little bit more challenging. But all of the information from a teledent exam is understood by a dentist. They see the need for treatment, they know how to allocate their schedule, and it's very easy for them to bring that patient in, or in the case of a mobile dental program, to send providers out and make it efficient for that program as well. We really want to show opportunities that have existed for innovators, but have always required lugging paper charts back to an office, a real time shift. We see applications that are really kicking in across the country with public health settings and innovative private practice models. So to us, there's kind of the RDH model where hygienists, different practice levels of hygienists, different training sets are off-site and reaching patients at that point of care. And then there's teledentistry, and I think the bigger picture too is those state restrictions and state practice acts and scope of practice and supervision levels all come into play. So anytime there's an opportunity for a hygienist to work outside of a dentist's office, we love it. We think that's a great opportunity, whether it's in a hospital, nursing home, school, or in private settings, whether it's a pop-up hygiene clinic at a company where hygienists can go see patients, reach them earlier, reach a larger number of patients than just the dental practice can see, and connect them to care. We also are moving into, and at the Greater New York Show, we're going to be introducing this. It's more of a collaboration platform. So even if you're in a state where there's restrictions on supervision for a hygienist, as a collaboration platform, we see the ability for a dentist, a periodontist, a hygienist, an oral surgeon to collaborate in real time, asynchronously, to review all of a patient's records, to not have this situation where you're getting faxes and email and secure email and mail and log into my portal and try to do a screen share, but you're getting a way where it's a central location, collaboration can occur, better treatment planning, faster treatment planning can occur, all to the benefit of the patient. We see a high drop-off rate from a general practitioner referring to a specialist. We want to increase the number of patients who see the specialist that they need to. Instead of just the endodontist when there's pain and they're going, we want to make sure whatever it is, earlier in the disease process, we're catching them and they're being referred to the appropriate place. And I think from a patient perspective, with teledentistry, now you have the ability for your general dentist, who you've got a long relationship with, and hopefully a really good one and a long one, that they're communicating with the specialist and they're collaborating and then getting back to you. So you might have a procedure done at your periodontist, but now the general dentist knows and they can follow up with you. You're getting a higher level of care. You're more looped into treatment, and needs are being met. We also see a lot of opportunity with medical dental integration. We want pediatricians' offices, urgent care, emergency rooms, where the amount of dental issues have skyrocketed and are tied to bigger issues of the opioid epidemic. So we want to be able to address that stuff earlier, get it so a non-dental professional can capture the data they need. And for us, it's visual data. It's definitely some level of clinical, it's a lot of clinical when you're talking with a hygienist offsite. But if you're trying to get an urgent care center who's got a physician's assistant or a nurse practitioner, we just want to capture some data that's helpful for a dental evaluation that a dentist could then review, treatment plan, and get that patient into their practice. And then longer term, we want to be connecting directly to patients. We want a patient to own their health information, for a provider to capture that. And we see that cycle as maybe a hygienist sees a patient off-site, a treatment plan is created by the dentist, it's shared directly to a patient who could do a live consultation with the dentist and act on an appointment, get in, or have treatment done on site. But we've closed that loop. We've made it go from just a screening program with a note home to looping that patient directly into the practice, however it may take a shape or form, and really addressing this huge opportunity and need for, we see it as both an opportunity and also a large number of patients are not seeing dentists. And I think we see in the dental market, dentists are thinking that traditional marketing methods, traditional outreach methods are going to bring these patients in, and it's not. We need to get out to where they are, and that can either bring them into a practice or find innovative solutions that reach them where they need to be. So we love our platform. It's really easy. I'm sure there's more that we want to continue to introduce to you guys with Patty and the Codology team of how to integrate teledentistry into practice models and also how to code it. And this is a great, blessing that the ADA approved these, and thanks for everyone who was a part of that. But they see the need is there. Teledentistry is a great Teledent is a great platform to do that. And the more we can see hygienists, providers embracing this, finding innovative solutions to do it, we're all for it. So.
Thanks, Brand. Patty, let's go to the next slide. Now I'm going to start with the first question myself, and I'm sure that all of you have some questions and some thoughts. My question, and I know this answer, but I don't know this answer probably as well as I could, and that is the whole part of HIPAA and what Teledent is already set up, because I mean, I've seen people, and I've even had it in my own life, where they're sending things over their cell phones, they're taking a picture that way, or even a meeting like we're using now. But talk about the HIPAA into your system and how you hear it like.
Yeah, it's a great point. We hear a lot of people, especially when we started, where people were saying, no, it's cool. I'm using my iPhone, I'm taking a picture, and then I'm emailing it to another provider for review. But we take care of that. We feel like there's so many ways that can get very complicated, costly, and confusing, honestly, to be HIPAA compliant in a private practice setting. It gets even more challenging when you're out off-site and you're trying to accomplish those goals of sharing records. They're not standardized, it's not secure. So we take that out of the equation. We make it fully HIPAA compliant. We make sure that within our system, large practice groups or private practices or hygiene practices, however they're organized, are all managing HIPAA compliant communications, HIPAA compliant user management, so the providers within the group can all be managed appropriately, patient data is shared securely, and we try to make it as turnkey as possible. So all you need is a Windows laptop and our software, and you're good to go. An intraoral camera helps, but you don't even need that. You could do a live video conference, get a consultation, and I can't underestimate, you know, I love seeing Patty here while we're doing a live video conference, and to us, we show a conversation that's really taking place where you've got a dentist, a hygienist, an intraoral camera, and so you've got 3 screens that not only can convey clinical data and information that helps the dentist treat and diagnose, but also helps the patient feel that they're connected to expertise, that they've got a hygienist who's an expert in their field with them hands-on, and you've got a dentist looped in who can build that relationship that's going to encourage someone to actually visit and get the treatment that's needed.
Thanks. Now, if anybody else has questions, what we're going to do, if it's okay with you, you say your name, what state you're in, and then whatever you have your comment is. Anybody wants to start? Because I'll call on you.
This is Cindy Purdy. I just want to say that I feel very comfortable that Patty has a professional toilet cleaner there too.
Hey guys, I got
in this live broadcast.
It was a sink cleaner. Our handle came off our sink. And my husband couldn't fix it. He didn't have the tools with him. So, Cindy, so you know what, Patty, you went out of the slide.
I know. I wanted to double check to make sure I actually had it recording. Go on.
Okay.
I have a question. You mentioned the person would have to have a Windows-based platform. Is there also a platform for people who have Macs? Because a lot of dentists and doctors and hygienists, we all have Macs. Is it more than one platform available with the Teledent?
Who was that? I know who it was, but go ahead. Please tell us who you are and why you're calling too.
This is Allison, formerly Illinois, now Colorado.
All right. So great question. Right now, there's 2 parts to our software. So one part, which is cloud-based, where you can create exams, create patients, review everything. That you can access from any browser. So from your smartphone, from a Mac, from a PC, you can access an exam, create a new exam, all from that. We have a local application which runs on Windows 10 now and will grow into Android and Mac, where you can then capture all of the information you need. So you can record video, you can capture still images, where we see that's kind of the application someone's using in the field, maybe with a tablet computer or a small laptop, where they're collecting all of the data. But aside from the ease of capture, everything can be done in the cloud as well through a browser.
Okay. And if you're going to be sharing information from one provider to another, do both providers have to have the mouthwatch, or can it be where one person has it and the other person is going to be able to open and read that via the cloud? I guess I just want clarification on that technology.
Yeah, so the way we set it up is right now, each provider involved would need a license. So typically, let's say a group with 3 hygienists, 1 dentist, and 1 periodontist, each of them would have a license in our system. With our collaboration platform, a feature we're going to be adding would be, let's say a patient comes in and they have a periodontist that they want to work with. So we would have a way for them to invite that periodontist on a one-time basis for that exam. So it doesn't have to be, let's say, an annual subscription for that provider. We still want them to be able to be looped in. But right now it is a per provider system.
Okay. Thank you.
Yeah, great.
Next question, response, comment, concern, challenge.
This is Connie. I'm in Virginia. One thing I wanted to ask, I know you just touched on it. It is going to be like an annual membership cost, a subscription cost on a yearly basis for the office?
Yeah, so I can go into a little bit of detail of that. We wanted to keep the cost low to get teledentistry adopted. So the way our pricing works now is it's $299 per year per provider. And that's unlimited everything. It's a Vegas buffet of synchronous, asynchronous, number of patients, number of exams, storage. You can use Teledent as much as you want, and it's still for $299 per year per provider. And then the only additional cost would be, do you need an intraoral camera to go out in the field? Do you have a laptop, or do you need to get a tablet from us, or can you go to Best Buy? So we wanted to work with your hardware if you have it, but we make great intraoral cameras, and we feel like when it comes to the world of telehealth, there's health data that varies, right? From an insulin meter that's sending different kinds of data, from a cardiac monitor that's sending different data. For dental care, a lot of what we're doing is visual data. It's a visual evaluation, so our intraoral cameras are the preferred way to do that, plus the webcam that comes on your tablet. But back to your question, yeah, it's $299 per year per provider.
Great.
Thanks.
Next person, anybody?
This is Denise in California. Hello, everyone. I have a question. Since I work in practice management, what I see in dentistry lately is that patients are really being treated as business as usual. So what I'm trying to do is change them to be practices that are more value-based, more risk factor-based in every practice that I go into. But how is it that if there's only a small percentage of us that are really focused on this value and focused on the risk and the health of a patient rather than the sickness of a patient, how are we going to teach the public that mouth and body connection, where most practitioners aren't hitting that education process, how are we going to teach that so that they understand that what we're trying to do is going to make them healthy? I'm starting to see, like, I want to get in touch with every cardiologist that's anywhere near a dental practice, because I feel that if we can talk to those specialists and say, hey, listen, when you see this, please screen them, look at their mouths, look and see if you see any sign, smell. We can smell periodontal disease from a mile away. Why aren't we really diving in to all of this mouth-body connection? Because if the patients don't get enrolled in their health, then how can we get them enrolled in their health through a teledentistry kind of way to do things? Sorry, that was rambling, but it's just one of those areas that makes me crazy. Great. I walk into a practice and the first thing they want to do is just clean teeth. But it's not about that teeth cleaning. That's the least important thing that I want them to do with that patient. I want them to prove that they're a detective and prove that that patient is healthy by all means that they can do. And what I don't see is any of that taking place until I have to teach it.
Denise, I think we have several opportunities that are currently happening as well as in the future, as well as, and this is, I'm going to talk about this from a bit of a coding perspective, but it's also a metrics perspective. As most of us heard this week, the guidelines for blood pressure changed. It's 140 over 90 doesn't wash. It's 120 over 80. I see nothing but huge opportunity with the oral systemic, as we know that we can affect blood pressure by someone's periodontal state or not. In addition, in 2018, along with the teledentistry codes, there's a code for HbA1c, chairside sepsis for glucose screening. Now, when we take those metrics that are definitely metrics that physicians understand, then we look at the platform that we have with teledentistry and start making those connections. That's where the change is going to happen. That's why I see this as finally we have a way to make that, because we've been talking about oral systemic for how long, but what are most people really doing differently because of it? Now, what's also happening at the same time using data is the traditional way of people coming in every 6 months for their cleaning, even though, I hate that term, even though for practice, a lot of practices, they still think they're being profitable there, but the data does not support that. We have much savvier consumers that are looking for more, and the offices and the practitioners that offer more are the ones that are going to benefit both financially, but also help move the paradigm, help shift the system to that value-based. Grant, what's your thought?
Yeah, I think what's great about teledentistry, you mentioned the cardiologist part, and we've had conversations with oncologists, cardiologists, any healthcare setting. We're looking at doing a pilot with NYU. We're in a general health clinic. To us, right now, that referral, I'll go back. When we first got into this business, we had a conversation with past president of the Pediatric Dental Association, Art Nowak. And he said, kids go into their well visits and the doctor says, say ah, and they look right past their teeth, down their throat to see their tonsils and throat. And there's this huge opportunity to catch dental issues early and have, while I think it's a huge challenge to get more medical disciplines to understand basic oral health issues and dental care and dental treatment opportunities, I think what I love about what Teledent and teledentistry can do is if that location had the ability to capture clinical quality intraoral images and data, even if it's just answering a basic questionnaire about what they're seeing and then sharing it with a dental professional, that patient is now in the dental system. They can have a care provider reach out to them, follow up, and address it earlier. So that if someone's going in for heart surgery, this is a way to connect them to a cleaning and treatment prior to that surgery. If it's an oncology consultation, they can not only for pre-chemo get preventive care, but lesions, any of those things can be identified earlier, soft tissue issues, and get a consultation with either a general dentist or a specialist who could help, I think, really loop that patient in earlier. And I think
Brent,
that's what I love about the port. Go ahead.
No, I want to jump on that one particularly because we have someone here that we call a prehabilitation specialist. That is Chris Potts. Chris, can you jump in here with the work that you're doing and the idea of prehabilitation for the oncology patients and maybe some ways that you can see this working and exactly what we're talking about here? Chris? See you there, Chris? Oh, there it is. Can't hear you yet, Chris. Nope. Chris. Nope.
Patty, this is Cindy Purdy.
Yeah.
While we're waiting for Chris, if you don't mind, I'd like to jump in and share a story of this week when I was using this very technology. I was working with a patient. I work in a rural area by myself. I'm the only person in the office, and I use this technology to send the information to my doctor, who's about an hour and a half away. I had a patient that needed to have screening prior to hip surgery. I was able to take the x-rays. I was able to take the periodontal charting, do their medical history, take intraoral pictures, and I could send it to my doctor, to my dentist, for him to review and give his clearance for the patient to have the surgery. But what was missing, what was most disappointing to me, is how impressive would that have been if I was then able to send that exact same information to that patient's orthopedic surgeon so that he could see all that we went through to make sure that this patient was clear for him to do the exam.
Absolutely. Chris, can we hear you yet?
I don't know, can you?
Now we can. There you are.
Yeah.
Okay, all right. I was on the wrong thing on my computer there. But, I think we see so many times in practice that with lesions and checking oral abnormalities, is this something that's a concern that needs to be referred, or can it be watched? Different things like that. That would be one aspect where this would come in very handy. And then also communicating with the patient's oncologist with that they are experiencing these oral issues, that is that a result of the treatment that they are experiencing, that they're undergoing? Is there a a cause for that? Is this a side effect, a known side effect of the treatment? What would you recommend? We would recommend this. Is that consistent with your treatment for that patient? And get that consult going right there on the spot to get that patient relief as soon as possible if they're experiencing oral issues.
And do you see from your experience with working with the oncologist that do you think that we could get them involved this way if we showed them something more than just told them?
I think that they do act more on a visual type thing. Their mindset with dentistry with a lot of oncologists is, the kind of, oh yeah, you're not really medical, type thing, which is unfortunate. But the ones that are really on top of it and that are state of the art and cutting edge are going to welcome, I think, because it takes less time than a phone call conversation with their staff, and then 10 people have to relay the message to the one that actually makes the decision. And so a 5-minute video consultation with the doctor, the oncologist themselves, I think would be very time efficient for them, or with their lead team member. But get it done in real time while the patient is there in our chair. And I think the ones that are really cutting edge will embrace it.
Terrific. Terrific. Anybody else?
Patty, sorry.
No,
I think one great thing too is, we Patty and I have talked about, when you look at telemedicine and telehealth, maybe it's telemedicine 2.0 or maybe 3.0, but dental is really at kind of 0.5. I think that doctors and health clinics and the VA and large organizations are constantly embracing live consultations, telestroke consultations. So from an ambulance, a patient can get a teleneurology consultation and a drug can be administered that can significantly decrease their risk for long-term effects from a stroke. So we see what's great for us when we have our intraoral cameras, we sell a lot of intraoral cameras to large health groups that are already embracing live video consultations, and then they just see our camera as a peripheral that helps them do dental consultations into an already existing infrastructure for telehealth consults. So whether it's telepsychology, telepsychiatry, neurology, dermatology, all of these areas are proven and well-regarded uses of telehealth technology. With dental, we see a lot more opportunity with it. So it's not as far-fetched or far off to get a medical provider, shouldn't say that, a non-dental clinician, a cardiologist, an oncologist, for one of those providers to embrace, great, here's an easy way for me to get a dental expert on the line, whether it's asynchronously or synchronously, and get their expertise incorporated into my treatment plan or diagnosis for this patient.
Brant, did I just hear you say that it's possible that the medical side is probably more open to it than the dental side is right now? Is that what you said? In some ways?
Yeah, possibly.
Yeah. So, yeah. Okay, that's what, this mastermind is about. Let's be very honest about what it is that we're experiencing, what we see, and where opportunities are. And, let's go back to Denise. I think you brought up a really good point. Is any of this helping you to see more answers for the clients that you work with?
Yes, absolutely. And I can see the stumbling blocks that we can have being on the dental side instead of the medical side. So I think that if we can really start that collaboration, that if a doctor, a dentist per se, is close to, let's say, a cardiologist in the same complex, in the same building, they should be developing these relationships and these rapports with them so that they can confer back and forth and use something like teledentistry so that we can show them what we see, and they can also have the same vision of everything on their side. Again, with the clearance, you know, when a patient needs to have knee surgery, the first place that now the orthopedic surgeons are starting to say, when's the last time you saw your dentist? We need to have you cleared before we can go ahead and do your knee surgery. So I think if we can really tap into the medical side, we can get the dental side to jump on the same bandwagon.
I have a question.
Certainly. Tell us who you are, where you're from, so we can you learn to know your voice.
This is Jeanette Miranda from South Dakota. So Brett, is it available to our medical counterparts, your program?
Yeah, so we call it a provider. We don't call it a dentist or hygienist. So to us, a hygienist is a provider, a cardiologist is a provider, a care worker in a nursing home is a provider. So as long as they're able to log in, they can capture that information and share it with the specialist that they pick, or the dentist that they pick, or hygienist that they pick. And it's really a collaboration platform. We want to continue making it easier so that someone doesn't need to know what CDT code they're selecting for a service. They're really just answering a few questions, capturing patient data, and sharing the images or videos, or initiating a live consult. But yeah, we have programs where we're doing a pilot program where there are mobile physicians who visit elderly communities, and those mobile physicians, when they identify the issue, they're seeing the patient far more frequently than a dental provider. They'll capture the data about that dental issue, assign it to a dentist, and then a dentist can triage the issue and schedule a mobile visit or transportation for that patient. So we're really starting to see a bunch of opportunities where medical providers are linking into this and trying to provide more, to that earlier point I think Allison made, like whole health, whole patient care for treating issues. They want to be looped in. They know patients want to have access to that data, and this is a really easy way for them to do it.
Thank you.
Yeah.
This is Allison. Sorry, this is Allison again. You know, I mean, I'm kind of in a unique practice setting. I work for an implant center where they do the surgeries. People get their teeth that day. Then I'm responsible for follow-up, hygiene. But I'm seeing where this system could be used in a lot of different ways. I mean, a lot of the patients that we have, before they even go in for their surgery, they need to have medical clearances, and it's being done kind of, snail mail or the old-fashioned way. That this could be something that certainly could expedite with all the different providers that are involved or that are giving clearance for any surgery, whether, like Denise had mentioned, whether it's a hip replacement or a knee replacement. But this could also be they're going in for major oral surgery and they still want to have that medical clearance ahead of time in collaborating with the medical side. But then I look at myself, as a hygienist follow-up with these patients. Because we're strictly an implant care center, we don't do any restorative care. So I see patients every day that still have an arch of natural teeth, and yet there's caries or there's decay or there's treatment needs. And, and I'm doing the old-fashioned way of filling out a referral form and say, go see your general dentist or somebody in your area. Because I get patients that come to me from several states, not just the Colorado area. They're coming from Nebraska and Wyoming and other areas where they don't have somebody that they want to go down a floor below. They want to go somebody in their hometown. And as a way to say, this is something that I, observed or diagnosed at your visit here, but now I want to share that information or be able to capture an image so you can take that back to Dr. Smith in Wyoming or whatever. So, I mean, there's so many different ways that this could be implemented, and it's just trying to develop a system where this works effortlessly, I guess, or with very minimal effort, to where the value is there, where everyone is seeing that, the receiving dentist at the other end that's getting the information, the patient that has something concrete, what's the best way? Do you give it to the patient who then takes it to the provider? Do you take it to the provider directly? I guess some of that is going to be trial and error and figuring out the smoothest way for something like that to work. But I think there's definitely opportunity.
Yeah, I think that's a great point. And, we've heard so much feedback from the various providers and use cases who are implementing teledentistry, where They want, you know, a PDF or a printout that they could share securely with a patient. So whether it's a screening program or an appointment where you would be able to capture that information, write a clinical recommendation for that patient, even if all you're doing is printing it out and saying, here it is, take this fact with you and bring this to the provider, they'll understand. And we want to be flexible. So if your implant center had a network of providers that you worked with, you'd be able to refer data directly to those providers. But if it's someone out of the loop, whether it's kind of the one-time share that we're going to be launching or simply providing the patient with some record, I think that's what gets lost, is how many practices just sit there and say, here, I have business cards from this practice. Let me just write what I think it is, and here, take the business card. And does that appointment get made? I think the statistic is like 54% of those referrals get followed through on. And I think a huge number of those are based on pain. So only when there's pain is that referral really being completed. But yeah, it's a great point. And we want to make that as painless as possible to really make any party in that care team. And I think that's a phrase you hear more in the medical community than in the dental, right? There's a care team for this patient. And so how can we loop that patient in so that everyone that's involved in it has access to the information, the patient is a part of that the patient will have an app from Teledent or branded to their practice or provider where they have access to treatment plans that were made for them. They could be involved in consultations. They could do a video chat with the doctor and actually hear what's being provided for them based on multiple parties in this care team deciding what's best for the patient.
Brant, I'm going to take things from here because I promised everyone that we will end on time. But you just batted a ball right to what I believe. I believe codes provide an opportunity to share things, an opportunity to measure things, opportunities to take it to the next level. This is someone, Denise said that what we need to have is we need a protocol, we need to have a written system for doing that. And that's, again, what I see in this group of the dental codologists, for us to create that. Now, Cindy and I are going to be doing that to a certain level in our book on critical choices, some basic protocols, but it's going to take more than just a couple of people to do this. Next slide, Patty. The choices are ours to make, and that's where I said this is the difference in waiting for the future to happen to us and us creating the future ourselves. And that's where together, and that's what's so great about Brant coming in and sharing with us what they're doing. It's just as open, and Brant, you can jump in here if you'd like, to hearing from us our thoughts on what we would like things to be, to really understand what the system is now so that we can help make improvements, because there's always ways that we can make improvements. It's those of us here in this foundational group that are so important. Again, the critical choices will be out soon, right, Cindy? Right? We're almost done? Okay, we're getting there. We're getting there. But part of it is because it is a moving target, because things are happening so rapidly. Next slide, Patty. Click. There we go. So this is recorded. If someone wants to have the recording of tonight's meeting, which would be an asynchronous connection, okay? We're going to go from synchronous live to asynchronous. You can listen to it otherwise later. Connect with me. Again, the website will be up soon where you can access any of them, but until that time, you can connect with me and I will give you a link to Dropbox. We have made our next mastermind a little bit sooner, so we don't cut quite as close to holiday time. It'll be on Wednesday, December 6th. We're going to talk a little bit more about the oral systemic, what we hit on today, and the HbA1c. I'm always open to your ideas too. I want this to be, again, the idea of a mastermind is that we are all equals and that we can all learn from each other. Again, our mastermind sessions are at 7 p.m. Central. And there is no day, I know that there's times that people can't make it or there's times they come in from work, so we appreciate those that signed in later. I did see Linda Jorgensen, Tony, and Paige, and some of the others that signed in later. Appreciate whatever way that you can contribute, but we want to hear from you. Next slide, Katie. because the one thing that we know is we are stronger together. 1 + 1 doesn't have to equal 2. I really like that kind of fuzzy math. We can, even with our beginning foundation of our dental codology community, that's where change is going to happen. Denise and all of us, we're going to create it. Next slide. So I want to wish all of you, again, that if I can be of any help, Patty's gonna go, oh, here she goes volunteering again. No, really, if I can be of any help on the coding things that you're dealing with now, if you want to connect more, I'll be sharing your information with Brant, and Brant, you can send him some more information on some details here. But let's stay in touch. And until we meet the next time, I want to wish you all a happy, very happy Thanksgiving and a safe holiday with your friends and family. Good night for now.
Night. Thanks, Patty.
Good night.
Good night,
Patty.
everyone.
Good night, Patty. Thank you.
Thank you. Bye.
Have fun in Hawaii.
Have fun. I'm going to go have some fun in Hawaii.
Have fun in Hawaii. Yeah.
My happy place. Hope you do.
Thank you.
Patty, I'm still on.
Okay. Patty? Yeah. Okay. Okay, I don't know where I am. I'm on the control panel. End meeting.